Welcome back to the Healthy Mouth Movement Podcast. Today we're going to talk about lip tie. So what is a lip tie? Simply put, it's a condition that restricts the upper lip. You're born with it. Either you have it or you don't. It's a short, tight band of tissue that tethers your lip, and it can interfere with breastfeeding, making it difficulty for babies to latch. If you're having a baby that is having a difficulty latching, you might want to consult your pediatrician or a lactation consultant. Lip ties occur when a piece of tissue under the baby's lip is too short and too tight, and it limits the upper lip movement. This tissue is also known as the labial frenum. You can feel yours by taking your tongue and running it up along your gum line around where your nose is. Some people's are shorter, some people's are higher. Everybody is different. But similar to tongue tie, which is that same frenum underneath your tongue, it makes it difficult for babies to latch and get their nipple properly around the areola of the mother's breast. So what does it look like? It looks different depending on the severity, and it can go all the way to the top of the gum tissue, or it can be just short right underneath your nose, but it kind of pulls that tissue. And sometimes babies develop that under their lip. And there's different grades from stage 1 to stage 4. That's why it's important to know what that looks like. You just lift your baby's lip and you can see if it's pulling or not. There's really no symptoms or no problems. The main problem that it occurs is difficulty feeding the baby, and that is the main cause of concern with a lip tie. The most common indications are struggling to latch, difficulty breathing during feeding, making a clicking sound, falling asleep during nursing, extremely tired. Sometimes they can be colicky, or they can have slow weight gain. The things that a mother can experience with a lip tie is pain during breastfeeding, their breasts feeling engorged, even right after nursing, a blocked milk duct, and fatigue along with nursing. Lip tie complications can be severe, and if your baby is having trouble gaining weight or latching, sometimes you might need to supplement with formula. So it's going to be something that you're going to need to probably see a lactation consultant about. And today I have a guest, Melissa Tyson, and she went through this with her baby. Her daughter is Jovi. She was born right before COVID, February 19th, right? Is that when she was born?
February 19th, yes.
February 19th. So, and her daughter is now the age of my daughter when we met. She was Faith's swim coach and taught her swimming, and we spent years together at the pool. And so I have invited her on today to talk about her experience with lip tie and what she went through. So Melissa, thanks for sharing this with us, because I think it can help some other moms out there that maybe are struggling with the same thing that you went through. So thanks for talking to us.
Yeah, no problem at all. Where would you like me to start?
So start from the beginning. Start with your story. Like Joey was born, what happened and what led you to looking at what was going on with her lip, or finding out that it was her lip tie that was the problem?
Yeah, so when she was born, she did not latch immediately at all. And in fact, wouldn't latch. So my mom is actually a lactation consultant, so she had been working with us. So we were trying a lot of different methods, and she just wouldn't latch. So we first of all had to start, like my husband was feeding her with like an SNS system, and feeding her like with his like little finger and a dropper, just to get some kind of milk in her. But he did that for the first week she was born. So she didn't latch for the first entire week. Of course we were trying, but it just was not going well. She was having such a hard time. And so that's how she was fed. We actually laugh about it, because like the whole first week she thought like dad's finger fed her, which, so that's like what she associated with it. So we had just keep trying different methods and different things. And we finally did get her to latch about a week after she was born. But it was certainly not a normal latch. with my mom's experience, she was able to tell me, like she's latching, but that's not what it should feel like and what it should look like. She was getting enough milk. So, her gaining weight wasn't necessarily an issue, but it was very painful on my side of things. And if you just watched her, we laughed because she sounded like a baby goat. She was like, I'm sure that's not attractive to look at, but it was like, her tongue was all over the place. You could just tell that she just did not have, the proper latch that she should have been having. So, when she went into the pediatrician, and I know pediatricians, from what I've heard, they are mainly concerned with gaining weight. So Jovi was gaining weight. So they weren't really concerned, more about the breastfeeding experience. It was more my mom who was, like, you should not be feeling that kind of pain. I mean, I was in excruciating pain. It was really miserable, and I wanted to give up. I was like, I want to be done with this. This is not worth it. This is horrible.
And most moms do.
Yeah. And I was very, adamant about wanting to breastfeed her. I knew that that's, was my personal choice.
Mm-hmm.
But I was at my end's wits with her. So it wasn't until like 3 weeks after she was born, we started more so kind of looking in her mouth. Because when they checked her at the pediatrician and when they checked her when she was first born, they just had said like, oh, we don't see lip and tongue tie, blah, blah, blah. And you kind of just listen. I'm first time mom. I'm like, oh, okay, well, she doesn't have those things. And yeah, like I said, it wasn't until my mom was like, well, maybe you should start looking, a little bit more in her mouth to see if we can figure out more of the problem. So sure enough, we weren't sure if she had a tongue tie. We didn't think she did based on what we were seeing. But, when you lifted up her upper lip, you could definitely see that she had a lip tie. So, I got my mom's opinion and she was like, yep, looks like a lip tie. Definitely take her. We went up north to a pediatric dentist, and we brought her in, and sure enough, they were like, yep, this is a lip tie. She didn't have a tongue tie, thankfully, because those two go hand in hand from what I have read. Yeah. So we were thankful that she actually didn't have a tongue tie, but she did have a lip tie. And so, yeah, they just lasered it. It was really quick. I think it was more painful for me than her because I was like crying in the waiting room, but she was totally fine. And yeah, I will say, like from that moment, I could tell that things were different. It wasn't like coming out of her mouth as much. So her latch definitely did improve after that. She still struggles. She's 11 months now, and, she still doesn't have what I would consider a proper latch. But it did resolve the issues from when she was really little, and you could just see where her mouth was and how much milk she was intaking, that it did make a difference.
That's awesome. And you're lucky that you had your mom. Otherwise you maybe would have given up and not known, correct?
Yeah. My mom teaches like all the breastfeeding classes. So she's, not that she would have been mad if I would have quit, but she was, she was like really in my corner, like, come on. And she was being supportive, as moms most are. And like I said, I know that it's not for everybody, but that was my personal choice, that I was really wanting to do that. So I just stuck with it. And like I said, it's still a challenge, but you got to do what's best for you. And thankfully I have been able to do it. So I know some moms aren't able, and I know other moms who have had multiple challenges. So
yeah,
props to them, because it's not easy.
It's not. And I've had friends that were experiencing that same thing and didn't want to do the surgery, and they just gave up and started doing bottle feeding. So it's a good thing that you had your mom and that, she was able to kind of guide you. And I saw that you posted a picture the day that Jovi had the release, and she was happy.
Yeah. She was totally fine. Like I said, it was definitely more like, I feel like hurt me more than her, because I was like crying in the waiting room, like, but she was totally fine. It didn't hurt. I mean, she cried, of course, but it didn't hurt her at all. She was like her normal self immediately after, nursed right after. She was totally fine. And to be honest, we debated, because, with a lip tie, you don't have to have it revised. Some people say that it will just go away on its own. So we debated for a long time, like a week, probably back and forth. My husband and I were like, well, what's best for her? What's going to be best for me? And so it was a hard decision, to be honest, because I didn't know if I wanted to go through that or put her through that. But then when I was to the point where I literally just wanted to quit, and we had tried a bottle with her. Most exclusively breastfed babies, of course, you don't want to give a bottle to right away because then they might prefer that. But because I was having so many issues, we did actually try a bottle with her, and she wouldn't take that either. So that's when I was like, maybe if we get this revised, it will help both of those issues. She still never takes a bottle. So that just happens to be the fact that she's stubborn and not her lip tie. But I'm glad that we did the surgery, because I have also heard that it can cause complications later down the road if it doesn't go away. So it was painless for her. It was quick. It was super easy. Everybody, that we went and saw was like very nice. And she was totally happy, completely herself immediately after.
Yeah, that's awesome. And I think that's great you did it, because sometimes if that is as low as what hers is, because I saw the picture, it keeps their teeth from coming together when they get older. So when they get older and you want to do braces, you'll have to get it clipped. So doing it when she was younger was probably much easier than waiting until later.
And that's what I've heard, that it can cause like a gap in between the two front teeth. And everyone, I did research and read and asked other moms who had similar experiences. And they have all said the same thing. Like, if you're going to do it when they're little, because that's when it makes the most sense. They're not going to remember it, versus like when you're saying when they're older, they're going to remember that, and it's probably going to hurt a heck of a lot worse. So, that kind of led us to making our decision also.
Yeah. And there's exercises you can do to loosen that also, like after you have that.
Yeah.
Shift. I don't think that you had exercises that you did, but you can kind of stretch the lip to make that stretch out a little bit. So that helps as well. And
we did. Yeah. They told us right after we did get it revised, they did tell us, I think like 3 times a day, just like really simple, lift her lip up. And she hasn't had that kind of issue since. So
you did do the exercises after. That's good.
We did. Yeah.
Okay. That's awesome. Thank you.
Yeah.
Thanks.
Yeah, no problem.
Sharing this information, because again, I think you were lucky in that you had a lactation consultant. So I think everyone probably should have a lactation consultant. I didn't have that when my daughter was born, and we had some issues, but not too bad. She did latch right away. She had more of a tongue tie situation than a lip tie. But it did resolve on its own. It wasn't a severe one.
Yeah.
But, you don't know what's going on, and they do check at the hospital, but I think they don't always know what they look for the severe cases.
Yeah.
The class 4, like really tight restricted, they don't really tell you to do anything if it's a class 2 or 3. They really only tell you if it's a completely restricted one. Otherwise they look and say it's perfectly fine. But when in essence, it may not be. So
yeah, I agree with that. And I am not knocking on like the pediatricians or doctors, they're just like, looking, like you're saying, for severe cases. But because we were told that she didn't have one, we just kind of assumed she didn't have one. And like I said, our pediatrician was, she was gaining weight. So she was getting enough, which that was their main concern. But yeah, it wasn't comfortable. It wasn't easy. It was challenging. And like you're saying, it's really easy to want to give up. And yeah, had it not been for my mom, like you're saying, I feel like everyone should see a lactation consultant, because breastfeeding is its own challenge. You don't know what's normal and what's not normal. And it's always good to have a second opinion, especially, as a first-time mom. There's a lot of adjustments and a lot of learning to do. And so it's always nice to have somebody to second opinion.
And bounce ideas off with. And that's why I'm thankful that you shared your story today, because I even see that now, even when I work in the dental field, a lot of dentists, if it's not a severe tie, even a tongue tie, they're just like, no, you'll be okay. But there's a lot of things that come along with that. Sometimes speech issues and sometimes, especially a tongue tie, shoulder issues and headaches and not being able to clean your teeth. So there's different things that you need to look for, not only just latching and gaining weight. So, and that's why I asked you to share your story, because you can see that it made a difference for you, and even just your comfortableness in being able to nurse something that you wanted to do. And it makes a difference when you nurse, because when you bottle feed, a lot of times with the palate, you want the palate to be more U-shaped. And when
Yeah.
you sometimes it's more like this. So when you nurse, the baby latches better, and it helps their facial development and their palate development and widens their arch for their teeth. So there's a lot involved in nursing that shapes your baby's mouth and facial structure.
Yeah. And, I would encourage, if other moms are going through this, or one, if they're having latching issues, to look at that, because we didn't look at it until she was 3 weeks old. And I probably would have done it sooner had we known that would have been was the problem. And like I said, it was really quick and simple. And I mean, like I said, we debated, because I didn't know if I wanted to do that, but the benefits outweighed, any of the risks. So
Well, it's scary because you know that it's going to be painful, and you don't want your child to hurt as a parent. But if you think of it in the long run, it's going to be more beneficial, then it kind of is a no-brainer. It's like, okay, well, now I understand that. So,
and I had read that it can actually, cause some discomfort for them when they're nursing. So that was another decision, even though she wasn't showing necessarily signs of discomfort, she was nursing, but she certainly didn't look normal when she was nursing. So that was another thing, okay, we're going to go and do this procedure, and that's going to be literally 5-minute procedure. It was that quick. Versus, if we don't get it revised, it may go away on its own, but she's little, they don't really know how to communicate other than crying, and which happens frequently when they're newborns. So I'm like, I would rather do that versus her be in pain when she is nursing, and I don't know that.
Right.
So,
and the exercises after are important too, because they can get scar tissue. So working that makes it so the scar tissue doesn't build up, and sometimes it can attach a little bit more even though they've released it. So those exercises are important.
Yeah, they said it can come back if you don't, keep stretching that out, because after they, lasered it can grow back. So they said, make sure that you're stretching it out. And yeah, she hasn't had issues since then. So
that's awesome. And she's beautiful. I'm
thank you.
so excited for you.
She's something else. We love her, but man.
So I want to thank you for taking the time to share your story and talking with us. And
yeah, absolutely. Anything I can do, like you're saying, to help other moms who might be in a similar situation and have a little bit of doubt and don't really know what the best decision is. And again, you have to make the best decision for you and your family. But for us, it was a good decision that we ended up doing that. So.
Right. Yeah. Thank you. And you're right. It's a personal decision for you. There's no wrong answer in this. It's just, what you feel, and you do have to go with what you feel in any healthcare situation, whether it's you or a family member.
Yeah.
You really need to go by the feelings that you're having.
Right. Absolutely.
They won't steer you wrong.
Agreed.
So thank you again. And we'll get your mom on here too to chat and help.
Yeah, you should. She's like I said, a book of knowledge. She has a ton of experience, so she'll probably talk your ear off.
Perfect. So thanks again.
Yeah, no problem.